There are lots of other tests that can actually be used. They're not very developed, but when you see somebody that has an elevated PSA, you don't know whether it's because of their age. As prostates grow in size or as men age, their PSA should go up. So there's definitely an age determinant range that somebody's PSA should be in. So there are different tests that take into consideration the volume of somebody's prostate. That would be something like PSA density. There are other tests that take into consideration how fast one's PSA is increasing, and that would be something like PSA velocity. So there are definitely different tests that you can use to determine whether or not somebody's PSA is elevated because of actual prostate cancer versus infection or an enlarged prostate. Typically, when we're using PSA velocity or PSA density, it's often times when we're looking to see if a patient has actually had a recurrence. So say a patient has had radiation therapy as definitive treatment for prostate cancer, and their PSA is slowly increasing. You don't necessarily know if it's increasing because of the traditional radiation blip that you can see in any patient treated with radiation therapy, or whether it's increasing because it's a biochemical failure. So there are a few tests that you can do, but one of the serum tests that you can do is a PSA density or PSA velocity. And if somebody's PSA is doubling within less than 6 months' time, then it's more indicative that it's most likely a recurrence.